here real quick. All right. Help! I can't breathe. Did you guys meet that new Rita Bacon woman? She knows her stuff.
Yeah, she's the new MD on the third floor, right?
Yes.
Yeah.
Good morning.
Dr. Holmes, we have a female patient, 25 years old, research scientist. She collapsed in the woods when collecting data. She has localized chest pain, trouble breathing.
It's asthma. Give her albuterol.
But there was no constriction of her respiratory tract. It can't be asthma.
Chance, go to the field site, grab some samples. You too.
All right.
Grab a blood sample, grab a sample of the fluid in her pleural cavity.
Hey, check this out. The differential white blood cell count indicates that there's a high concentration of basophils.
Well, that's interesting because her test results just came in for her interstitial fluid and she has a high mast cell count. Let's go show Dr. Holmes. The patient's test results show that she has an increased basophil and high mast cell count. This obviously is an asthma. Here are her results.
Well, our patient has chest pain, increased temperature, increased white blood cell count, and increased mast cell count. What does this look like to you guys? Fairman?
Well, these are symptoms of inflammation, but there's no apparent signs of swelling.
Look what I found. I found this mold in the woods. I wonder if it has anything to do with her breathing problems.
But her respiratory tissue wasn't constricted at all.
But it wasn't a respiratory tissue that was inflamed.
Okay.
I thought you research scientists were supposed to be intelligent. Guess that's why you're just a tree-hugging hippie.
Who is this? Oh, this is Dr.
Just the janitor. But that's not important. Ever heard of the Rena fungus?
Of course, the Rena fungus thrives on sugar maple trees.
Gee, well, you haven't been around any sugar maple trees lately, have you?
Of course I have. Sugar maple trees are all over the Ramapo.
Obviously, you don't catch up on sarcasm very well. The Rena fungus releases a
deadly pathogen that causes swelling of the connective tissues.
Initially, a pathogen enters the body via respiration. The pathogen enters the lining of the bronchial tubes and enters the intracellular fluid. This causes damage to the cells at and around the contact point. When mast cells and basophils come in contact with these pathogens, they release histamines and prostaglandins. They cause a localized swelling of the surrounding tissues. This inflammation allows white blood cells to enter the intracellular fluid. The white blood cells then destroy the pathogen via phagocytosis.
By choosing to be a tree hugger by profession, you inhaled these spores, allowing them to enter your connective tissues and kill local cells and fibers. By altering the composition of your interstitial fluid, your body then released prostaglandins, proteins, and potassium ions to combat the spores, which cause localized necrosis. This change in tissue composition triggered your body to release mast cells. Essentially, your body was attacking itself in response to the spores. Continue exposing yourself to this pathogen. Slowly, this will happen all over your body and you will experience total system destruction.
Yes, I understand this, but why wasn't I able to breathe?
Well, the tissues of your pleural cavity swelled and placed pressure on your lungs, causing your shortness of breath. The pain you experienced was from the swollen tissue being compressed within the cavity. Place her on antifungal treatments and steroids to reduce the swelling.
Who was that?
That was Dr. Holmes. He's your head doctor.
My head doctor? Am I going to be okay?
Everything is going to be just fine. Your body has been fighting the pathogen since the start. Regeneration of tissue started soon after the baconospore entered your system. The increase in spread of the pathogen was inhibited by your body's inflammatory response. We're going to look for an abscess filled with pus, which is debris, fluid, and necrotic tissue. Now we're going to drain this abscess to remove any infection and to decrease scar tissue formation, all right?
Well, your fibroblasts will continue the healing process by stabilizing the injured tissue with collagen fibers. Your steroids will reduce the swelling, and your antifungal medication should remove any spores in your tissue. You'll be out of here in a few days.
Down.
Had you byline again?
Wait.
Just keep going.
I got it.
Coming anytime soon?